Brace yourself because every year, more than 500,000 people in the United States alone rush to the emergency room for kidney stones. That's right, 500,000. Picture this. That's enough to fill up 5 Major League Baseball stadiums. Quite a shocking revelation, isn't it? Kidney stones. They're not just a couple of words you hear on a random health show or read in a forgotten corner of a magazine. They're a real, pervasive issue that's causing waves of discomfort and distress across the nation. These tiny, hard deposits that form in your kidneys are more than just a minor inconvenience. They can cause severe pain, sometimes even resulting in hospitalization. And yet, despite their prevalence, there's a mysterious aura surrounding them. Many people don't fully understand what they are or how they come about. That's a staggering number, isn't it? But what exactly are these kidney stones that's causing all this commotion? Kidney stones may be small, but they pack a punch. They're hard deposits made of minerals and salts that form inside your kidneys. But how do these tiny troublemakers take shape, you ask? Well, let's dive into the origins of kidney stones. The story begins inside our kidneys, the body's natural filtration system. These organs are hard at work, purifying our blood and removing waste products through urine. But sometimes, the delicate balance within our kidneys can be disrupted. This disruption can occur due to various factors such as dehydration, certain diets, or even genetic predisposition. Imagine this. You're not drinking enough water. Your body, being the efficient machine it is, starts to conserve water. This means your kidneys are now producing concentrated, dark urine. In this concentrated environment, the levels of certain minerals like calcium, oxalate, and phosphorus can escalate. When these minerals reach a saturation point, they begin to crystallize, and these tiny crystals can stick together, forming what we know as kidney stones. You see, kidney stones are not an overnight phenomenon. It's a process that can take weeks, months, or even years. And while some stones are small enough to pass unnoticed, others can grow to the size of a golf ball, causing excruciating pain as they travel through the urinary tract. Certain diets can also contribute to the formation of kidney stones. Consuming foods high in sodium, for example, can increase the concentration of calcium in your urine, creating the perfect environment for stones to form. Similarly, diets rich in animal protein can increase the levels of uric acid, another key player in the story of kidney stones. Lastly, let's not forget our genes. Just like eye color or height, a predisposition to form kidney stones can be inherited. So if kidney stones are a common occurrence in your family, you might be more likely to develop them too. So we now know where these pesky stones come from. But how do you know if you have them? Kidney stones are a master of disguise, often showing no symptoms until they move around within your kidney or pass into your ureter. But when they decide to make their presence known, they do so with a vengeance. So what are the telltale signs of these unwelcome intruders? Let's dive in. First up, we have severe pain. This isn't your typical tummy ache. This is intense, sharp pain that often starts in your back or side below your ribs, then radiates to your lower abdomen and groin. The pain may come and go, but don't be fooled. When it goes, it's not gone. It's just biding its time. Next, we have blood in the urine. This is a pretty clear red flag. Seeing pink, red, or brown urine can be a sign that a kidney stone is on the move. It's not a sight for the faint-hearted, but it's a crucial clue for identifying kidney stones. Then there's nausea and vomiting. You're probably thinking, hold on, aren't those symptoms of a lot of health issues? And you'd be right. But when combined with severe pain and blood in the urine, they could point to kidney stones. This is because the nerves of the kidneys and the gastrointestinal tract are connected, causing an upset stomach when a stone is causing havoc in your kidney. Finally, we have frequent urination. If you find yourself taking more bathroom breaks than usual, it could be a sign that a stone is lodged in your urinary tract, causing irritation and the urge to urinate. Remember, these signs can come in any combination and may vary in intensity. Everyone's experience with kidney stones is unique, so it's important to listen to your body and seek medical advice if something doesn't feel right. Paying attention to these signs can save you a lot of trouble down the line. But what if you could prevent kidney stones in the first place? While kidney stones are common, they're not inevitable. With a few lifestyle tweaks, you can significantly reduce your risk. So, how can you arm yourself against this painful condition? One of the simplest and most effective actions you can take is to keep your body well hydrated. Drinking ample amounts of water each day helps dilute substances in the urine that can form into kidney stones. Aim for at least 8 to 10 glasses of water daily. And remember, if your urine is light and clear, that's a good indication you're drinking enough. Now, we're not suggesting you completely overhaul your diet, but a few modifications can go a long way. High levels of sodium in your diet can increase the amount of calcium your kidneys need to filter, making you more susceptible to kidney stones. Try to limit your sodium intake by avoiding processed foods and adding less salt to your meals. Similarly, a diet high in animal protein can increase the level of uric acid in your body, another contributor to kidney stone formation. Try to balance your protein intake with plenty of fruits, vegetables, and whole grains. Remember, it's all about balance. Maintaining a healthy weight is another crucial factor in preventing kidney stones. Obesity is linked with a higher risk of kidney stones, so it's essential to engage in regular physical activity and maintain a balanced diet. However, avoid crash diets as rapid weight loss can also lead to stone formation. Calcium is a bit of a paradox when it comes to kidney stones. While too much calcium from supplements can increase your risk, a diet rich in calcium can actually help prevent stones. Aim for calcium-rich foods like dairy products, broccoli, and kale, rather than relying on supplements. Lastly, moderation in alcohol and caffeine consumption is also advised. Both can lead to dehydration, a key risk factor for kidney stones. Remember, your health is in your hands. Stay informed, stay vigilant, and most importantly, stay hydrated.